Um, will you do BBA? That's bilateral breast augmentation for a patient that smokes 10 to 15 cigarettes a day. Um, this is a tricky one. And the reason it's tricky, because if it was a tummy tuck, if it was any sort of body contouring, tummy tuck, breast lift, face lift, arm lift, thigh lift, it's an easy answer. No way, Jose, it ain't happening. So it's a definite no, smoking and those operations. Not because I've got it in for the patients or got it in for smokers, because of the wound healing. Every time you have a cigarette, you reduce the blood supply to the skin and you increase your risk of wound healing. And if you're doing surgery where you're closing things tight, if you can imagine it a tummy tuck, you ever seen how tight that's closed? If that doesn't heal up properly, it can really dehiss and come apart and go really bad. So it's a definite no on that. For BBA, breast augmentation, it's just a straight line scar. So it's actually not that bad, the healing of a breast augmentation, because it's just a straight line scar. But the problem with the breast augmentation is the consequences can be significant if the wound doesn't heal up. Because if the wound doesn't heal up, you get an infection. And if the infection gets to the implant, you have to remove the implant. So that's going to be a much higher risk in someone who smokes 10 to 15 cigarettes a day. So my gut feeling is to say no. I think it's probably best not to do the breast augmentation. And what I would hope to do in that circumstance is I would hope to talk to the patient and get them on side so we realise we're doing the decision together. It's not me saying you can't have surgery. It's me saying, look, if you can't stop smoking, if you really can't stop smoking, perhaps you're better off not having the surgery. I think with 10 to 15 a day, I think I'd probably go down those lines. I think 1 to 2 a day, I might be saying, look, you need to stop for the 2 weeks after surgery. The day you have surgery to 2 weeks after, get that healed. So I think that's, that'd be reasonable. But 10 to 15 cigarettes a day, it's a big deal. So I'd say, look, if you cannot give up, I completely understand that, and that's fine because it's your body and your right. But I really would not have surgery. My advice to you would be not to have surgery.